In today's world of healthcare, behind every safe and effective drug therapy, there is a team of professionals ensuring that medicines bring cure and not harm. They are our hospital and administrative pharmacists. Today, as we celebrate the World Pharmacist Day, we shed light on some of the activities of the Association of Hospital and Administrative Pharmacists of Nigeria, Bayelsa State chapter. Hospital pharmacists, a licensed pharmacist with advanced training to specialize in providing direct patient care.
I want to have an idea of the normal thing we have on ground.
Their mission is simple: to optimize drug therapy, prevent medication errors, and improve patient outcome. While administrative pharmacists deal with all things regarding management and regulation of pharmacy practice. Let's take you through some of the activities of the Association of Hospital and Administrative Pharmacists of Nigeria, Bayelsa State chapter. Medication therapy review. One of their core activities is medication therapy review. Hospital pharmacists carefully assess patients' prescription, identify potential drug interactions, duplications, or inappropriate doses. In addition to medication therapy review, there is patient counseling. Pharmacists of AHAPN Bayelsa provide direct counseling to patients, explaining how to take medicines correctly, the importance of adherence, and what side effects to expect. Let's hear from one of the members of AHAPN Bayelsa.
My name is Pharmacist Jerome Ojenewi. I've been part of the pharmacy family in Bayelsa State. All right, and of course, like what we do here, like everyone knows pharmaceutical purely. So the students will come around once they have challenges, they meet the doctors, and they have to come here to fill their prescriptions. And we try as much as possible to be very professional and prevent, because sometimes familiarity with students or patients, other patients, they want to come directly to assess their drug without really following the proper channel. So we try to instill that discipline there so that they follow the proper channels and to prevent self-medications and what have you. It's a patient-oriented and not drug-oriented. So we try as much as possible to interact with that patient. So we interact with them and let them open up their fears and try to sort out the problem as it comes. It's a good one. We're hoping that, but the major challenge is because cost of drugs. Yeah, extremely been very expensive and meeting up with a population of over 1,000 students at the moment. So me, on behalf of myself, the Nigerian Law School as a tutor, want to wish all pharmacists in Bayelsa and the Federation a happy Pharmacist Day.
Also, as part of the key activities of the Association of Hospital and Administrative Pharmacists Bayelsa State chapter, members collaborate with other members of the healthcare team.
I'm a pediatric pharmacist and the head of pediatric pharmacy unit at FMC in Agua. This is the general clinic setting, and as a pediatric pharmacist, our task is to ensure that our children's medications are taken care of, and they know that the dosing is based on body weight most of the time, and so we ensure that their medications are appropriate based on their age and weight. And we have here a playground that enables our children to be comfortable while they are waiting to be attended to.
We carry out a lot of duties that involve pharmaceutical care. It involves drug detailing, medication review, and checking out some drug therapy problems. There we try to optimize drug therapy in patients. We cannot actually do this alone. We do it along with some of our healthcare professionals, particularly the doctors and the nurses and the patient relationship.
The collaboration with other healthcare professionals does not just end there. These pharmacists also monitor patients' response to therapy, adjust doses when needed, and recommend alternatives when treatment goals are not met. Let's hear from another pharmacist on monitoring and follow-up of patients.
As part of our routine activity as pharmacists, I'm here to provide drug counseling services to my client that is we as pharmacists ensure that efficacious and safe medications are made available to the client.
Pharmacists have to be there to tell the patient proper way to take their medications.
AHAPN members also ensure continuous medicine supply, procurement, and inventory management to ensure cost-effective use of resources to prevent shortages and wastages. Another pharmacist of AHAPN Bayelsa speaks on this.
So, my name is Dr. Wakupuchinyere everyone. I'm a hospital pharmacist. I oversee whatever happens in the store, where we procure medicines, distribute to other units for onward dispensing to the clients and patients, which are the end users.
A major activity of AHAPN members is also promoting rational use of medicine through effective drug use management and professional training of pharmacists and pharmacists in training, including interns and clerkship students. An interview with the Director of Pharmaceutical Services at the Federal Medical Center, Yenagoa, and he had this to say.
My job, basically I play leadership of the department, and I'm responsible for the overall management and strategic direction of the department. So that entails overseeing all aspects of pharmaceutical services, ensuring safe and effective medication management, while also collaborating with healthcare providers to ensure optimal healthcare for all patients. Now, I also manage staff, because for me to be able to achieve all these things, we have units and there are staff, that are deployed to these units to help us achieve all these our objectives that I've stated. I also want to add that as the head of the department, I'm also responsible for developing and implementing policies. It aligns the vision, aligns with the goal, and aligns with the mandate of the hospital. Now, basically, the mandate of the hospital is one, hospital is care for patients. We are there. The other one is research, also conduct research. The other one is training.
Furthermore, policy development and quality assurance is also part of the activities of the Association of Hospital and Administrative Pharmacists of Nigeria. They help develop treatment guidelines in conjunction with other healthcare workers and enforce regulatory compliance of pharmacy practice in all its ramifications.
And this is achievable using drug formulary management.
The Director of the Pharmaceutical Services, Bayelsa State Ministry of Health, reiterated this.
I oversee pharmaceutical services in Bayelsa State, and primarily I make sure drugs are safe, available for everybody in Bayelsa State. We have a drug distribution center where drugs are made available to all our facilities, all our health facilities in the state. We also have Bayelsa State logistics management coordinating units that coordinates public health commodities across facilities too. Then we do pharmaceutical inspectorate activity, making sure that all our premises where drugs are sold, and that means patent medicine shops and pharmacies, properly registered, people that are regulated to sell private commodities to the public. So I also coordinate other activities as directed by the Honorable Commissioner.
Through their work, hospital and administrative pharmacists reduce hospital readmissions, cut healthcare costs, and improve the quality of life of countless patients. They also engage in public health campaigns, community enlightenment on safe medicine practices and preventive health. This year's theme for the World Pharmacist Day is Think Health, Think Pharmacist. The Association of Hospital and Administrative Pharmacists of Nigeria, Bayelsa State Chapter, is poised to strengthen health systems through continuous provision of services, despite the enormous challenge and prevailing economic realities. AHAPN Bayelsa is bridging the gap between science, management, and compassion, ensuring every medicine fulfills its promise. Remember, pharmacists are the custodians of safe medication use.
I'm pharmacist Olodiama Providentia. Happy World Pharmacist Day. Think health, think pharmacist.
My name is Eresia Barry Fidi. As we celebrate the World Pharmacist Day, when you think health, you think pharmacist. Happy World Pharmacist Day.
My name is pharmacist Marcus Akarimi. Think health, think pharmacist.
Whenever you think health, think pharmacist. I am pharmacist Gloria Williams. Happy World Pharmacist Day.
Consult your pharmacist. So whenever you think about your health, think pharmacist. I am pharmacist Bovai Clement Inini. Happy World Pharmacist Day.
Happy World Pharmacist Day 2025.
Think health, think pharmacist. This message is brought to you by the Association of Hospital and Administrative Pharmacists of Nigeria, Bayelsa State Chapter.